For a person who loves a pet, an animal is a loyal and friendly companion. From an interview of 23 dog owners above 70 years of age, it was reported that a dog would pick up on if an owner was noticeably unwell, and the animal would give the owner a sense of structure and purpose in their daily lives. Over 90% of dog owners regard their animals as valued family members. A key conclusion to make from this is that companion animals may be particularly valuable for older people recovering from an illness. In addition, an animal motivates the owner to take control of their daily lives. It makes the owner feel that they have responsibilities they want to take on. While the owner feels that the animal needs to be cared for, having a dog can also help make them part of a social network. This enables the owner to be brought into contact with other people when out walking their dogs. Another point to make is that companion animals can not only help maintain or enhance the physical health of older people, but also affect their psychological well-being. Animals can be perceived as facilitators in a patient's role in recovery, rehabilitation, and general care, since they can be attributed to both physical activity and psychosocial stimulation. Overall, animals give the provision of support when feeling depressed and a reason to fight for recovery.
Benefits of animal-assisted therapy. According to Duffin, 90% of 751 nurses in their study believe that contact with animals helped improve patients' health. It also showed that there was a 50% reduction of medication taken, an idea discussed as well by DeCourcy, Keister and Russell, where they believed animal-assisted therapy aids in pain management and reduction of medications. Ekstrom and Nordgren say having dogs in a nursing home had recorded to reduce levels of agitation for the elderly living with dementia, and the dog visits reduced heart rate and the incidence of yelling. The dogs provide companionship despite the level of cognitive functioning the elderly may have, and therefore reducing overall loneliness. Negatives. DeCourcy, Keister and Russell discuss risks of animal-assisted therapy, including fears of animals, allergies, cultural bias, and immunocompromised patients should not be exposed to animals due to the increased risk of infection. Animal-assisted therapy is also temporary relief and only provides a short time of interaction in a recreational setting, compared to clinical care which is ongoing. Another consideration of this type of therapy, some people just do not enjoy the company of animals. Patients' experience of animal-assisted therapy. DeCourcy, in a study, reported that one of his patients had chronic pain. However, after interacting with a dog, his pain reduced. Another study by Kawamura and Nayama said a male diagnosed with vascular dementia and aphasia slept a lot and barely interacted with others before animal-assisted therapy. However, after, he was more active when throwing the ball for a dog, expressed his emotions more, and interacted with the little things around him. Alstrom, Johannesson and Johnson also said over 70% of dog owners had reported that a dog gave them purpose and structure within their life.
Several ethical, clinical, and professional issues need to be considered when determining the effectiveness and relevance of using animal-assisted therapy within the elderly. One of the major talking points is whether it is ethically cruel to restrict an animal to merely performing assistance tasks to assist an elderly individual. Is it wrong to potentially prevent an animal from the physical activity they require in order to care for an elderly person who may lack the mobility to meet the animal's needs? Physical violence is very common among dementia patients, according to Isaacson, Granheim, Ostrom, and Carlson, which identifies a potentially harmful environment for these animals to be in. As animals lack the skills to reason with confused or aggressive individuals as a result of their cognitive condition, it means they may be vulnerable to mistreatment with no way of protecting themselves. As many assistance animals are used to prolong the ability of elderly individuals to continue living independently in their own homes, the welfare of assistance animals may be at risk. Without external assistance, there is no way to ensure that these animals are receiving adequate food and care if the cognitive capabilities of the elderly person diminish. It is essential that someone is responsible for maintaining the welfare of assistance animals while they contribute to the welfare of the elderly. A large number of patients with dementia and Alzheimer's are located within hospital and aged care facilities, which raises hygiene concerns for other inhabitants of these locations. Added germs and potentially harmful pathogens accompany these animals, which can prevent these locations from being sterile. It also impacts the inhabitants and staff that have allergies to certain animals, impairing their ability to effectively complete their day-to-day activities. Although the cost of assistance animals is not passed on to the individual, it is extremely expensive to train an animal to act as a companion. Assistance Dogs Australia outline the cost of training and associated expenses of being in excess of $35,000 per dog. For a sufficient number of assistance animals to be distributed among the population, greater funding is required for the organisations providing training and access to assistance animals.
In the studies by Peterson, the use of robotic animals showed that even mechanical animals can help reduce the level of stress and anxiety in dementia patients. This will be highly recommended as it's more suitable for the nursing home and hospital settings. Even at home, they don't require the full-on care that the real animal would need. The added bonus of hygiene is the major plus side because a robotic animal is more hygienic than a real animal. Other studies by Majak and Mena observed that animal-assisted therapy helped to calm down the patients who had Alzheimer's disease and dementia. They helped to identify that the animal-assisted therapy program can reduce the amount of aggressive outbursts a patient has and will have, and it also helps to boost their overall level of happiness by making them feel like they are at home and not in a medical institution. This is seen by the decreased level of depression that is observed from the patients. It is observed by the articles used in this video that animal-assisted therapy is a useful tool to helping the elderly in their last stage of life. It gives them a companion, and many might be alone, or to improve their level of health. As Duffin stated in their paper, many nurses believe that animals can improve a person's overall health status. This indicates that the animal-assisted therapy program should help elderly people with a health issue, or if they are by themselves. In homes, it helps them to relive their youth, which calms them down. This is seen through Peterson's, Majak, and Mena's papers. All of these articles listed shows how beneficial the animal-assisted therapy program is to the elderly participants they used in their studies. However, the negative points against the animal-assisted therapy program, such as allergies, cultural bias, and immunocompromised patients, it is clear that more studies need to be done to prove whether animal-assisted therapy works, and also to see if the positive outcomes can outweigh the negative outcomes. One major question that will play a part in future studies is if robotic animals are the future of animal-assisted therapy programs.